My proudest moment being a nurse in Yaz is leading the infection prevention control team during the pandemic, COVID-19. It required a lot of leadership, being really resilient and lots of support out to frontline staff across the whole trust to make sure we're all safe and protected during a really difficult time.
My proudest moment is being SRO for the mental health programme and having our first mental health response vehicle on the road supporting patients in a different way.
My most proud moment is dealing with all kinds of ages, from newborns to the elderly patients, and helping them come back to their, achieve their own level of capacity where they can support themselves. It's an amazing achievement, and that makes me proud as a nurse.
From a nursing background on the ward, now on the telephone with the patients, providing support for them, knowing too well that I might be the next person to help someone in need in their homes, on the streets, providing the first aid and providing the fast response they can ever get before they get to the hospital. I feel fulfilled and I'm happy to help the community.
One of my proudest moments with Yaz to be, discussing with my patients, triaging them and reaching a safe outcome for them. Just hearing them say, thank you so much for your help, that gives me a lot of joy, and I pride myself in being a good and compassionate nurse.
My proudest moment is setting up the own response from mental health push model.
The proudest part of my job is imparting knowledge to not only patients but new learners, new clinicians as well.
My proudest moment to date is what I'm going to say, because I think there's more proud moments to come, is watching the IUC and the EOC teams come together and build and shape our remote patient care transformation programme, and all the work underneath it, NHS Pathways being the biggest one that we're on with at the moment.
Proudest moment as a nurse was when a patient told me on the phone, "Thank you so much, you're such a darling." I think it might be just a simple statement, but it really made my day, and I think that is the essence of me coming into nursing.
So one of my proudest moments, since I've only been doing this for a really short while, being able to assess patients or triage patients over the phone.
One of them is basically being part of research and having the opportunity to shine. Okay, and I've been involved in a few projects. One of them, which was the purple card, which is the assistant card that we use at NHS 111.
For us, working as paramedics and nurses together has been a great process to go through. We work really well as a multidisciplinary team, and we achieve great outcomes for patients, I think, because of our clinical expertise and backgrounds and knowledge that we bring to the patients that we triage on a day-to-day basis, and good outcomes for patients.
Yeah, I'd echo that. I think seeing how the two nurses and paramedics can use the different skill sets to come together and work as that multidisciplinary team, and how that collaborative approach can aid the patient and the higher quality of care that we deliver.